My Doctor, your health anytime, anywhere. Hello, lovely viewers. Welcome to the My Doctor podcast. My name is Mwesigwa Joy and I'm your host. So to remind you of what we do here, so we normally host various health workers, doctors, nurses, midwives, medical students to basically talk about health, to clear out misconceptions about health, for health awareness basically. So if you have any topic you'd want us to talk about, please feel free to comment in the comment section, give us feedback on the various sessions that we have had, and we'll be happy to hear from you. So for today, I have a very, very interesting guest. He's going to introduce himself. It's called Dr. Fadhul, Mr. Fadhul. And today we're going to be talking about cancer. According to the Uganda Cancer Institute, they receive about 7,400 cases every year. And there are 33,000 new cases in Uganda every year. Some don't make it to the institute. So we really need to talk about cancer. What's the role that society can play in cancer? Yeah, so I cannot wait to dive into the topic. Hello, Mr. Fadhul.
Hello, Joy Mwesigwa.
How are you?
I'm okay. How are you?
I'm fine. Thank you for coming to our podcast today.
No, thank you for inviting me, really.
You're welcome.
It's been a pleasure really being here with you.
Okay, so could you please introduce yourself to the viewers?
My name is Usama Fadhul. I'm a fifth-year medical student pursuing this degree of medicine surgery at UCU School of Medicine. And as of now, I'm serving a good number of roles, but particularly for the reason why we're here, I'm serving as the Vice President of the Uganda Christian University Cancer Society. Yeah, that's the general introduction I can get. When I get more titles, maybe I'll be able to listen to them.
No problem. So, okay, for the start, could you tell us something about cancer in layman language that anyone can understand?
Okay. Yeah. Thank you for that. Cancer, I think Uganda, they call it kokoro. Cancer is I can say a complex topic, really. Not a complex topic, but it's somewhat a hard topic. It's emotionally drenching. Like, if you start mentioning cancer to someone, they are going to be scared. So cancer is a disease that we have. This disease manifests when we have our cells misbehaving, dividing. Normally, your cells divide, but they divide in regulation to a certain, let's say, your body regulates how they are supposed to replicate and divide. But when cancer then kicks in, they replicate in a way that they're not coordinated. No one is controlling. It's like having a child that you cannot rule, an unruly child at home. And you maybe as a parent, as a sibling, you may know how hard it is to have an unruly child. Yeah. So that's basically cancer. You have your cell, it is just dividing in any way it can. So because it's dividing in any way it can, it will give you like swellings that you'll see on your body, big masses that you'll see on your body. Then because it's dividing uncontrollably, it will move to wherever it wants to move. And when it goes that side, it will affect whatever is that side. If it was from your, let's say, lungs, it will go to your abdomen, it will do anything it wants. So cancer is basically that disease where you're going to have your cells misbehaving. And when they misbehave, they're going to do a good number of problems to you as a person. Symptoms are very many symptoms. The common ones we see is weight loss. People lose a lot of weight because as these cells are dividing, they require energy. And that energy, the way they're going to get it is from the food you eat. And then it's not enough because for them, they're just dividing uncontrollably. Then they're going to start metabolizing your stores, taking your stores of energy that you had. Then they're going to start breaking down you yourself. So at the end of it all, you're losing weight. So that's one of the commonest symptoms of cancer, weight loss. Yeah, then others may be in. So in Uganda, as you had said, Uganda Cancer Institute reports 33,000 cases every single time. The sad part of it is that we lose 20,000 of those people who come for that. So why really do we lose these patients? Because we know we have medicine in Uganda to treat cancer. We have medicine, we have chemotherapy, we have radiotherapy, we have immunotherapy, we have a lot of medicines. We treat the cancers. Why do we lose these patients? That is a system. Okay, to answer that question, it's really, there are a good number of parties that play a role as to why we have a possible reason as to why we lose these patients. But one of the ways that is linked to these deaths is that people do not know about cancer. A person is going to be home, they're going to lose weight a lot. They're not going to matter because it doesn't manifest normally. Like, it will not show you that I'm cancer, like how you see you have malaria and the fevers come, and you're like, oh, let me go to the hospital. For it doesn't do that. It's
progressive.
Yeah. It just eats you up slowly by slowly. So for them, they will be home and they do not know of any change. Like, they don't know anything about it. They're losing weight. They're like, oh, I'll eat. Maybe I'll gain the weight. Then they'll eat. Then they have their own stress. So they stop really minding about that. And at the end, where the symptoms now come in, the bad ones, the ones that come in, the pain. Pain is one of the other ones that usually the big symptoms. The pain comes in. Now that's when they're like, oh, let me run to the hospital. And when they run to the hospital, sadly enough, majority of the medications and the treatments we have are not able to very well mitigate the cancers at end stage. Usually we consider stage 4, 3 and 4 as being the last stages whereby, okay, treatment is surgery. Maybe you want to remove that cancer. We cannot do it. So that's the sad part. Now that may be the contributing factor as to why we are losing 20,000. And that's not only in Uganda, but in majority of the low-income countries, that's what's happening. Now, in the high-income countries, these people have managed to actually educate people about cancer, to create awareness, to screen about cancer, to do a lot. So when people start getting these abnormal symptoms that I don't understand, I am eating every single day, but why am I losing weight? I eat my lunch, my breakfast, my supper. Why am I losing weight? I'm having this pain. I'm not understanding why. I'm having a swelling. Let's now for the ladies, I'm having a swelling in my breast. I'm not understanding it. Why? Yeah. So those people, they know that I'll run to the hospital. Now, as of this side, I don't think we have strong of awareness to people, because this comes down from the person themselves when they're going to seek health, someone. So I do believe at some degree, maybe the other questions you have about cancer, to some degree I've somewhat answered why we have cancer and why we are losing a lot of patients because of cancer.
Okay, so to our viewers, hope you have heard Mr. Fadhul. If you have an abnormal swelling, you're losing a lot of weight, please go see a doctor. Go see a doctor immediately. So Mr. Fadhul, you talked about the UCU Cancer Society, right? Could you tell us more about it? What do you do as a club? And
So thank you for that. The UCU Cancer Society, someone said we shall just abbreviate as UCUSCUS abbreviation. So it's somewhat funny, UCUSCUS. The UCU Cancer Society was formed, I think, within the start of this year. We, as well as the worship team of UCU School of Medicine, we made an outreach to reach out to Uganda Cancer Institute. Now, if you ask any person who has gone to Mulago and you ask them about Uganda Cancer Institute, they'll tell you it's one of the saddest places in Uganda. When you go there, it's just sadness. And I will tell you that my personal opinion, I can't disagree with whoever told me it's one of the saddest places in Uganda. It's actually is. It's a very sad place. People there are suffering, like it's really, really bad. So our outreach was towards the pediatric side of the Uganda Cancer Institute. And before we went to Uganda Cancer Institute, they gave us a briefing of cancers, most of the pediatric cancers. And majority, the funny thing, not funny, but the thing is majority of the pediatric cancers are curable. We have medicines that cure them. But then, why is it that then our children who are on Uganda Cancer Institute are going to die of cancer? It's because some people who are at Mulago, Uganda Cancer Institute, yes, we are treating the cancer. A doctor is going to bring the chemotherapy. A doctor is going to give you the immunotherapy, the radiotherapy. But you as a person, what are you on? Because same thing applies in medicine. For any medication you take, you have to eat. So as the patients are there being managed for the cancer, it is sad that they do not have the basics that they want, like the basics: food, drinks, soap to wash the clothes, clothes to put on. Because then if you're you've undergone a surgery, they have dressed you with wound dressing, you need to cover it up, let's say, with a cloth so that you don't you don't be at risk of infection. But then you find someone with a dressing that's exposed. So that also brings, so we find that yes, we remove the cancer, but then other things are contributing to this person's death. Because they're not eating, it's contributing. They're going to have low blood sugars that are going to now cause more adverse effects that we do not know. So because we had all this, and you're like, yes, we treat the cancer, but the person is not treated. So as a club, we said, maybe, as I don't believe Jenny was there, if it's possible to supply some form of support to these people, then it will be really, really good. Now, some people who have been in some schools that have, is it called the C2 club, that the 3C club, the 3C club, people who have been in those schools that have the 3C club, you've been providing support to cancer patients. Uganda Child Cancer Foundation is also providing support to those patients, but the support may not be as enough as we want. So any helping hand is needed. So the multiple universities have cancer societies. As you say, you are a young you say School of Medicine, a young university, we didn't have one. So we thought that, would it be really nice if we also in some degree put up a club focused for cancer, because at this time I'd come as a worship team focused for cancer. In this one, we can be able to target Uganda Cancer Institute and help anyone we can at Uganda Cancer Institute, or any cancer patient that we may come. Maybe you're on your ward and there's a cancer patient, you support them in one or another. And support usually comes in the material things, the food, the giving them clothes, because people may be there at home and they have like a very big wardrobe, but they don't never put on those clothes, and there's some people there who may need them. So giving them the clothes, doing all that, we can support that. And also, because that may be patient-based, you're helping the patient, giving them clothes, the water, so they eat. But then the person who is taking care of that, how are you leaving them? The emotionally, the mental state. Because undeniably, as we said, some people come at late stage cancer, we're not going to do anything. Then palliation. Now, it's very, very detrimental to someone to lose a child, a loved one, anyone who has been close to them. But in this way of providing support, how are you preparing? Okay, not preparing them, let me come out wrong, but how are you going to reinforce their feelings when this person eventually finishes palliation and they continue? So that's the support we are trying to look forward to. Like at that time, it was prayer. When we went there, I realized that actually prayer may have done more than the material things we brought. Because it started as just us singing at the reception area with a few people. At the end of it all, roughly every caretaker was with us. They are singing songs to Christ, praying. And when we stopped our worship session, they took on the what? They took on, they controlled it themselves. They took on. So that showed that impact that we did brought up hope to some of them. Yes, they may know that I have a patient I'm caring for. The doctors have told we cannot do anything. We just have to palliate. Someone who may not know palliation is we are trying to give someone a good quality of life as they progress to I would say their death. So in that way, we're trying to avoid pain. We're trying to, because pain is a very bad thing in cancer. It's very, very, very bad. The pain in cancer is a 10 out of 10, I would say. So we are trying to palliate them, prepare them for that. So as you're trying to palliate the patient, also try to do something for the caretaker, because they're going to lose someone they love. So the prayer that can be of importance, the words of encouragement, affirmative words, like you encourage someone. I think there's a research that, there's some research I read about that words of affirmation actually play a role in someone's emotional stability. They affirm them. They were like daily affirmations that you can deliver to someone, maybe via SMS, maybe anyone. They can actually improve their way of life. So like these affirmations that maybe we don't have a lot to provide to them, but we talk to them. We're like, you get through this, we help them out. That can support. So the idea of Uganda Cancer Society is to provide support and care to the patients at Uganda Cancer Institute who may not be able to receive this care, because ideally also the treatment of cancer is going to incur a significant cost. So in this way, we're trying to support them in other ways that they may not be able to support themselves. Because you tell a mother that your child has a cancer, with this treatment, any mother would want to treat their child. They may not eat. They themselves, they'll say, I will not eat. Let me handle my child. So if they are they're handling a child medical bills and all that, then if there's a supporting hand to food, you can see also a change. You can also feed yourself. You'll be like, yeah, they are doing the thing, but let's try to help out with the food. It's like a humanitarian action. You can just support him.
Okay, thank you so much. I think that was a very detailed explanation of what the society does. And at the end, we will put the numbers and how we can support the society, right? So now I would want you to tell me, have you had any personal experience with a cancer patient, and how was it? Could you give us a story of how your experience was?
Okay, in my third year, I started rotating in on the wards at Mengo Hospital, and that was my first encounter with a patient who had cancer. Now, that encounter I had was a patient who was a newly diagnosed cancer. It was a cancer of the stomach, C of the stomach. So it was not bad. I was like, they looked okay. Like, he looks well nourished. The pain wasn't there. His issues, he was just vomiting a lot, and his vomiting had blood. Yeah, that's cancer. Also, this is how cancer of the stomach is. And then I remember in our textbooks of pathology, I remember the symptoms were very many. I was like, these guys may have lied. So that was third year. Now, in third year, I think in my research semester, we do what they call palliative care. And in palliative care, we got a chance or an opportunity to be able to visit homes of a person who is under palliation and suffering from cancer. Now, my view of the other patient in third year, first semester in internal medicine ward changed when I saw an actual patient who has been suffering with cancer for a long time. They had cervical cancer and cervical cancer, prostate cancer. We have cancer called Kaposi sarcoma, and breast cancer are the 5 common causes of 5 common cancers we have in Uganda.
Uganda, yes.
And they're very, very aggressive. They cause majority of the deaths we have. So she had cervical cancer. Before I explain to you, the thing that is about cervical cancer is that you can screen it very early. But she had it. Now, she may have had it because of the awareness that we talked about. People are not aware of actually what we have, that how can I go and screen for cancer? Can I do this? I think nowadays they immunize against human papillomavirus,
yes.
a virus that they link so much to causation of cervical cancer, which we've said is one of the commonest cancers we have in Uganda and the most aggressive ones. So in missing this patient, the mother had provided the picture of how this lady was before.
Wait, how old was she?
She was around 30. In late 30s. And this was the mother's only child. And that lady who was having cancer had children who are staying now with the grandmother.
Yeah.
So at around her 30s, they showed us a picture of how she looked. And me, I saw the picture after I seen the patient. I'm like, okay, she's well nourished. Everything I didn't expect. So the mother is like, okay, we'll go to the bedroom where she is. When we reach the bedroom, I cannot explain this to anyone who may be watching the video, but it wasn't a pleasant sight. And I'm sorry to say this, it was not well. Like, if you're listening or watching picture a well-nourished person. Now, picture the skeleton of a person, but with skin on it. Then compare the two. Now, put this before, this is after. When we are treating cancer. So this was our patient, well-nourished, but earlier on was well-nourished, but right now she was bedridden, in a lot of pain, crying about the pain. Imagine constant pain that you're not going to constant pain. Just imagine constant pain. Say you have a wound and someone just puts like a needle on you for the whole day so that pain stays there. Now that's what you should imagine. Imagine pain for the whole day. She's there lying in bed. Now that's on the patient, for her issues are pain. Now imagine the mother who is caring for this patient, well knowing that just preparing for the day they don't want to see the day when she goes, because it's her only child. And they've put almost all they had in treating the patient. Now that's on the mother's side. Emotionally, she's not okay. Her herself, she had complaints of some diseases that were disturbing her. She felt pins and needles in the legs. You tell any medical student pins and needles, the first thing they'll be like, diabetes.
Yeah.
So she had pins and needles in the legs. That's the mother's side. Now the children have school. And children like going to school. And ideally, we are in a society where we know that education is the key to success. Remember, we said most of the money and majority of the money they had has been put towards what? The patient who is sick. The mother doesn't have too much money with her there to basically treat herself. then how will she, the grandmother now for the children, how will she now care for the grandparents, take them to school, do this? Now, with this effect of that, okay, if I'm to try to explore the potentials, okay, what I've seen as a person, not particularly for a cancer patient, but what I've seen in a setting where there is limited resource, these are children who are going out to start being on let's say not the streets, but they're going to leave education and try to find another mean of getting money to care for the family, to care for themselves, and some ones may try to care for their siblings. So then they'll start doing a lot, going to the streets. Nowadays you see very many children, young children selling the eggs, or carrying eggs, but what's the reason why they are doing? Because you would expect them to go to be going to school. As others are going to school, for a poor child is carrying eggs to go out and sell. So those are one of the potential reasons why. But that when I saw that patient, actually I got a different picture of cancer than the picture I had. It's actually a very sad issue. And now that continued, because in palliative care, you visit more than a home. You visit 2 homes in a day. Then the next Wednesday, when your group goes, you visit another patient. So that just worsened with the more patients I saw. And then we reached Uganda Cancer Institute, where now we were on the pediatric side. Children, earlier on we were seeing adults, now children. Children hit different, I would say. You see a child suffering, anyone sees a child suffering, okay, it's any painful. Human sees a child suffering, it's very painful. Because a child is a person who is imaginative. They're imagining, yes, tomorrow I'm going to wake up, go see my friends, play. But then you see that person, let's say you are the mother of that person, and you see your child on bed, sleeping, crying of pain, constant pain. And it's a child, they cannot tell you that it's here, they're just crying because they cannot explain what they're feeling. So you as a person listening or watching, try to view that picture of a person who is in pain, deranged, they're sick, they're losing weight, they don't know what they're doing. So that's a picture that I can try to explain to a person with cancer. Until you get exposed yourself, maybe you have your own view that's different from mine. Me, in my view, I saw the caretaker, I saw the patient themselves. But sometimes also the doctors get affected by this treatment. Okay, but by the patient. Because as a doctor, any doctor, you would want to treat your patient and you would really love to see them walk out of the hospital and go home. Previously, I had a patient on ward and I was really happy when I saw them leaving. I was like, yes, go. But now for you're on the cancer ward, you're treating, you're excising the tumors, but they're not eating, they don't have money for food. Your treatment is at some point being worthless, as you could say. Yes, you've removed the primary issue, but now these other issues. So that's my experience with cancer, I would say.
Okay, so I think that's very heartfelt, sad. Cancer patients go through a lot. So as the society, what can we do to help?
As the society in general, there's the individual themselves. Society, we have individuals, we have people. Okay, you're a person, then some people who are in the working class, they're working, then work also has its own issues. So as a society, the best thing we can do is support. If you have a cancer patient, support. I think I can bring it out in this way. You know the prevention, there's prevention, Yes. Prevention where you prevent a disease from happening. Prevention whereby the disease has happened, now you're trying to prevent it from progressing. Now prevention, the third prevention is that the disease is there, but you do not want, preventing the complications of that disease. So cancer itself has causes, and as society, one of the things we can do is make people aware of the causes of cancer. I'll take an example of cervical cancer because it's one of the common ones we have in Uganda. For the girl child, cervical cancer has been linked to early sexual intercourse. One of the linkages of it is very early sexual intercourse. It has been linked to that. So as a girl child, if you're there, you can try to first keep yourself for Jesus. You can first try to keep yourself in that way. And when you keep yourself, we have the vaccine for human papilloma virus. The virus has been linked strongly to cervical cancer. Go for that vaccine. I believe these vaccines are free. I was on the immunization clinic for at Mengo for some time. I've not seen anyone pay money for the HPV vaccine because that vaccine is on your immunization card. You're supposed to get it.
Yes.
So you go and get that vaccine. It's free. You get it. So that offers you a certain level of protection. The prevention of early sexual intercourse prevents you from that. That's just for cervical cancer. Then breast cancer, we have there's a gene we screen for that's heavily linked to breast cancer called the BRCA gene. You go for these screenings as a person, you see if you have it or not. There are teachings that they do in the hospitals whereby now this comes in when you try to, it will come in way of spreading awareness. We go to let's say a society. Let's say we go I'll give an example of YSA because most of my life I grew up in YSA. We have a teaching to the people of YSA involving the community leaders. We tell them, please call people. We come here, we teach about this cancer. So this is breast cancer. How will you know to have symptoms of breast cancer? There's a way they teach the ladies how to palpate for masses, abnormal masses in their breasts. So in that way, you're trying yourself to screen yourself, and then you also go to the hospital and they screen for that. So early screening for some cancers, not all that we can screen, but early screening for some cancers is okay. Then there are some people who say that work is heavily before I go to work, there are behavioral characteristics. One of the behavioral issues is smoking and taking of alcohol. These have been heavily linked to certain cancers. What you can do as a person is avoid that, because the burden of cancer is real. Cancer is it's a very, very bad thing, and it carries a very huge burden. So what as a person you can do is do some behavior changes. Do not drink alcohol. Do not take cigarettes. If there is something psychological that you as a person you relate to the reason as to why you take a lot of alcohol, we do have psychologists. There are other means of handling that psychological issue that may be putting you into the stresses of searching for things like alcohol and all that can predispose you to this cancer. Because the more you take progressively, you're going to develop an addiction to them, and cancer will come with your chronic use of the alcohol, with your chronic use of the tobacco. So that's when it will come. So you are addicted. When you get addicted, you'll be using all the time, and the more you put this alcohol into you, remember we said our cells are dividing rapidly. So it's going to alter the things that regulate the replication of cells. Then if the policeman is not there, we're just going to cross the traffic lights, but relentless, and accidents are going to happen. So the same thing is going to happen. The person guarding is not there, so cells are going to replicate. But who made the change of the person not being there? The behavior, the tobacco you take, the nicotine, the alcohol, that's going to change. That's going to bring up the change. So awareness is key. Awareness is going to give us screening. People are going to go for screening. People, when they start noticing the weight changes, are going to be like, let me go and they check. Because now they know that this is how cancer manifests. So now they're going to go and they check. So when they check, they may get relief that, oh my God, it's not cancer. Maybe I just had a malaria that was not bringing fevers and it's giving me weight loss. Oh my God, it's not this. And maybe when it's a cancer, there is a high chance because of the awareness, we are going to catch it early. Stage 1, stage 2, remove it. You're okay. Then when you remove it, we shall screen for genes maybe that may have caused it. If they're not genes, then we will manage you progressively. Continuous follow-up. So in this way, we're giving you a better life. You get a better life from all this. So as society, we can do awareness. From people who can actually advocate for awareness, we can promote awareness to cancers. Society can support. You have a patient in your, let's say, community suffering from cancer. Support them. Support them emotionally. Support them financially, if possible. Support them with the basic needs, if possible. If you have surplus, support someone who doesn't have. Because as we said, there are medical bills that are incurred in here, strong medical bills. Someone may not be able to pay for all that. I'm speaking maybe on an average Ugandan. Some people may actually support themselves, but for those who cannot,
I think most can't. So support. Emotional support is key, because emotional support is what's going to prevent now mental health issues in a person who has lost a cancer patient. The depression,
is that's what's going to help that person continue with life. So society, we can promote awareness, we can support cancer patients, we can care for cancer patients, and we can advocate. Okay, advocacy is basically the same as awareness, but advocacy, you're actually calling for awareness.
Yes. So if someone wants to reach out to UCU Cancer Society to support, how can they do that?
So yes, you can reach out to us, and you can reach out to me particularly. I can provide my number, my phone number, which is, I have an MTN number. It's a 0773 99 23 and 14. We'll repeat it. It's a 0773 99 23 and 14.
Okay.
You call anytime, I'll pick. Okay, not like late in the hours, but you call.
Work hours,
I'll pick. I'll surely pick.
Okay.
Yeah. Then that's one of the ways you can support. We have some outreaches that we have organized or collaborated with some people to reach out to. October is Breast Cancer Awareness Month, and we say in the 5 common cancers we have in Uganda, and the 5 brutal ones, breast cancer is
a month. Yeah.
So we have that we have collaborated with certain organization, and we're going to go to Uganda Cancer Institute. It's I think on the 12th of October. Yeah, 12th of October. So we're going to go to Uganda Cancer Institute. If anyone who is watching, listening, you can join us. You come and see. You can donate anything that you have, anything, money, clothes, soap, anything, scholastic material, anything you have, you can provide to us, and we go with it that side. You yourself, you can come, because maybe if you see what's there, in one way or another, you'd also want to carry on the thing of trying to establish awareness for cancers. So we have that organized, and we have another something we're trying to plan with the worship team to go and pray with them.
Yes.
Just to pray with them.
Same day?
No, that's on another day. The dates maybe for that I'll forward to you, and maybe in the next podcast or the next video you will be able to,
to tell
publish
people
it.
about.
Yeah.
Okay.
That one, arrangement. We are still planning to go to the Cancer Institute and offer prayer, because prayer, maybe to a Christian, because Christians pray. Okay, prayer to anyone. We have one God. Prayer to anyone is a key. It strengthens someone's emotion.
Yes.
Brings up hope. Hope is a very good thing. Hope is something that keeps people going. So we do go this, we go provide the hope to the people. We may not have sugar, we don't have anything, but just a mere prayer is going to strengthen someone maybe who can be able to give themselves sugar, but they do not know where to find hope. So in that way, we can also handle the emotional aspect of someone. So yeah, we have the one in 12th October, breast cancer awareness. Yeah, it's Pink October. We go and see them. In that way, someone can support. The phone number I've given, in that way you can support anyone. If you have mobile money, feel free to,
Yeah, please. Okay.
So, yeah, that's one of the ways someone can reach out to us. And any other cancer organizations you can reach out to. I know Uganda Cancer Child, UCCF, Uganda Cancer Child Foundation, which is also here. You can also reach out to them and support them in any way you can. I think they have a website that is running, giving out any donations you can. You can go to their platform and donate anything that you want. Yeah.
Okay, thank you so much, Mr. Fadhul, for creating awareness about cancer. And our viewers, hope you're really going to reach out and support the Cancer Society. So we have come to the end of the podcast. So I'd like you to give some closing remarks. Probably tell us maybe your social media handles, where we can follow you, maybe for even upcoming projects and everything. Yeah. So give closing remarks and the handles.
Okay, so for closing remarks, the closing remarks are, in Uganda, we do have medicine that treats cancer. In Uganda, we have potential doctors that can treat cancer and its complications. In Uganda, we do have means of treating cancer. We can refer to the cancers we can't handle to a country somewhere, and those people will manage the cancer. The only issue is that people come late when, regardless of the doctor's skill, they cannot do anything. Imagine a cancer of the stomach that has gone to the brain. You're treating the stomach, but it's already in the brain. Then it has left the brain, now it's in the lungs. So the issue is people coming late. The best way of mitigating this, people seeking for medical attention late, is by promoting awareness about this cancer. Because not everyone is a medical doctor who has studied cancers and they know how they're going to come. And you cannot blame a person for not coming early because they did not know. So the best way to mitigate or to somewhat reduce the mortality rates we have in cancer is to promote awareness, and so that we can seek for help early when they start seeing the early signs that are not so specific. Early. They go early, they seek the early, okay. They go for, promote awareness, we promote early health seeking behavior, like good health seeking behavior, so that we can treat them at a young stage. And then also, we treat holistically, treat the patient emotionally, treat the patient physically. Then treat the caretaker emotionally, then treat any person around emotionally, like be a sympathetic or empathetic person. This. So in my closing remarks, really, we can treat cancer, we can cure cancer, but the best way to do it is if we promote awareness. We shall, the 20,000 we have deaths we have out of the 30 people we report every single year. They said in 2030 we may be able to double from 30,000 new cases to 60,000. But from the 20,000 we lose, when we start awareness, we are going to decrease that number.
Yes.
Individual by individual to a very low level. And the more we promote this, our children will also know that, okay, the more we bring up awareness, our children also know. I feel like when you're a child and you got a fever, your first thing was like, I have malaria. So the same thing with cancer. If we start promoting it, even the young people, the children, and the people they will give birth to, the cycle will continue, and we shall promote better health-seeking behavior, we shall mitigate cancer. So for the social media handles, I don't know them off head, but we do have a TikTok channel that we just created, TikToks. So it's called Uganda Christian University Cancer Society. I believe we also have one in LinkedIn, still the same thing. Twitter, we also have it. Yeah, so you can reach out to us in any of those platforms. And we have a publicity secretary who is good at replying to messages. Anything you reach out to, they'll be able to respond very fast. So you can reach out to us in those platforms. If you can't, maybe if you've searched and you can't find them, I provided my number. It's on WhatsApp. You can text me on WhatsApp, call me. I'll be able to respond still.
Okay, thank you so much, Mr. Fadhul. I think this is a topic we really needed to discuss and create awareness about. So thank you very much for coming. To our viewers, what is our take home? In Uganda, cancer is it's there. Cancer is there, yes, and it's curable, yeah. So as Mr. Fadhul has told us, make sure if you're able to screen, make sure you screen, research about the different cancers. If you have a familiar history, go and see a doctor, and like breast cancer, they will check for the BRCA gene. For the ladies, if you're sexually active, get time and do cervical cancer screening, yeah. Let's screen, and if you have a patient who has cancer, it's important to note that there are 5 stages of grief. This is where we'll stop. So they may first go through denial, yeah. Then they may go through anger. They are angry with everyone. They may go through bargaining. Then they'll go into depression and then accept the situation. So as a caretaker or as a doctor, it's important to be patient with the patient and the caretaker as they go through all the stages of grief. If the patient is always angry, as a caretaker, it's okay. Be calm. They will get through it. They will accept after some time. And some of these cancers are curable, yeah? We have a source. Even if it's not curable, we can improve the quality of life. All of us can help and improve the quality of life. If you're out there and you would want to help, you're in the society, you can improve the quality by donating something, yeah? These people don't have food, as Mr. Fadhul has told us. They don't have things to use. They don't have basic needs. So please feel free to donate through the number we provided. Feel free to donate anything. If you want to be part of the awareness, reach out to us or Mr. Fadhul. Yeah, this is a collaborative thing, yeah? We need to help these patients. So this has been the My Doctor podcast. Thank you for staying with us, and thank you for reaching this far. You could comment in the comment section what you thought about the video and any other topic you'd want us to do, or anyone you'd want us to host. Please comment. Yeah, thank you so much. My name is Mwesigwa Joy, and I'm your host.
My Doctor, your health anytime, anywhere.